We'll now hear about acknowledging the competition with a presentation from Dr. Evan Deutsch from Einstein Medical Center and Dr. Erin Greenleaf from Washington University School of Medicine.
Thanks for the opportunity to participate today. We were given the topic of acknowledging the competition. If we look at the data, this all comes from the various NRMP and other match data that was available. If we look at the 2020 main residency match, there were over 40,000 active residency applicants. There were 34,200 positions offered. 100, almost 2,000 were unfilled. 1,900 almost through the SOAP process, and then 300 after the match process.
Are you clicking forward or backwards now?
For the vascular surgery integrated residency match of 2020, there were 59 programs with 75 positions. There were 153 applicants, and 73 filled positions were filled with 61 MD seniors, which is the fourth-year medical students, 2 MD grads, 5 DO seniors, 4 non-US IMGs, and there were 2 unfilled positions. So the obvious competitors for vascular surgery would be interventional radiology or integrated cardiothoracic surgery. But how about other surgical programs like integrated plastic surgery or general surgery? If we look at the competition, there were 153 applicants for vascular surgery with about 2 applicants per position. For integrated IR as a PGY1, they had 206 applicants for 22 programs and 38 spots, which was about 5.4 applicants to 1 position. Cardiac surgery was about 3.2 applicants per position. Plastic surgery about 1.6 to 1, and general surgery was almost 1.8 to 1. Obviously, they have a lot more applicants and positions. Again, looking at it, and you can see how dramatically different it is across the specialties. The matches were filled. Again, vascular was filled with 61 MD seniors, cardiac surgery filled with 32, IR 25, plastic surgery 165, and general surgery 1,033. But what about the other surgical specialties? Aren't we all competing for the people that wanted to go into surgical fields? So I looked at the data for neurosurgery, ENT, urology, ophthalmology, and orthopedic surgery. And again, lots more programs and positions than for integrated vascular. Obviously, a lot more applicants for these positions, but the ratios were actually not as high of applicant to positions as it was for vascular. So the residency match summary, 0.2% of offered PGY positions in the main residency match were integrated vascular surgery residency positions. 0.4% of the applicants applied to vascular surgery. Out of the 6,891 applicants for 4,266 positions in vascular, cardiac, IR, plastics, neurosurgery, ENT, GU, ortho, ophthalmology, and general surgery, there were 153 vascular applicants with about a 2-to-1 ratio of applicants to positions offered. CT surgery and interventional radiology, there were more applicants for interventional radiology with fewer PGY1 positions, with higher ratios of applicants to positions. Are they more highly coveted? General surgery and integrated plastic surgery, there were many more applicants as there are more general surgery applicants. There were more positions, obviously 20 times more than vascular positions, but there's slightly lower ratios of applicants to positions. Is this more favorable for their applicants? And now,
Yep. Can you hear me now? Good. So we'll shift gears now and run through some of the recent data pertaining to the actual fellowship match. These are the numbers from the 2019 match. So those are for the 2020 appointments, essentially the fellows who started last summer. You can see that there were 96 programs, 118 positions, 130 applicants, 115 filled positions, and you see the breakdown there, with 3 unfilled positions. So you can compare this this data with the NRMP data from the previous 4 years, and there really is no delta in the number of programs that vascular surgery fellowship match offers. There's 3 fewer positions and pretty much a static number of applicants, and so a relatively static number of applicants per position. Next slide. Now, in terms of the competition, who do I think of when I think of other fellows who are kind of taking my cases? I think of the IR fellows and I think of the interventional cardiology fellows. And so while IR and interventional cardiology and vascular surgery don't all steal from the same resident pool, this is something that, certainly medical students are thinking about when they're considering what initial pathway to go down. From the medical student standpoint, for vascular surgery, IR, and interventional cardiology, they're roughly the same length of time. IR, is 6 years, interventional cardiology 7, and for vascular surgery fellowship, that's a total of 7 as well. But it is notable that both IR and interventional cardiology offer more positions, but also have quite a bit more applicants as well. Next slide. So then who are we competing with for vascular surgery fellows? We're competing with all the other subspecialties that recruit from the general surgery pool. So cardiothoracic surgery, plastic surgery, hand surgery, critical care, surgical oncology, pediatric surgery, and MIS. But potentially, or the specialty to probably pay the most attention to is thoracic surgery. Next slide, please. So this is the data we have from May 2020's match. So those are the applicants who matched this past May and who will be starting this upcoming summer. You can see that for vascular, the applicants to positions was 1.1 to 1, with 100 programs, 129 positions offered, and 136 applicants. This is just slightly more competitive than hand surgery and critical care, which were 1 to 1, but not quite as competitive as the specialties, the 5 specialties listed above hand surgery and critical care. Next slide, please. And just in case this is something that you consider when you're thinking of putting together your rank list, this is the breakdown for the 2020 fellowship match appointments. This is the breakdown of the applicants. Again, vascular surgery had 129 positions offered, 124 filled, and had 77 of those were USMD applicants. This is actually the lowest percentage of USMD applicants among all of the various surgical subspecialties. We had 62% USMD, and then the other 38% were non-USMD. So relative to the other specialties, this is sort of the breakdown. Next slide. So in summary, for the vascular surgery fellowship match, 1,329 applicants for 1,105 positions in all of the various surgical subspecialties. We had 136 vascular surgery applicants with about a 1-to-1 ratio of applicants to positions offered, which is a lower ratio than for all the other surgical subspecialties, with the thoracic surgery having slightly more applicants, but 28 fewer positions. Next slide. And I'll turn this back over to Dr. Deutsch for the further match or residency match.
So this was the data that we just had the residency match, and this is just a quick snapshot of what we saw comparing the last integrated match. The number of vascular applicants was up to 181 because there were a few more positions this year as well. But compared to, there were still higher numbers of IR applicants and CT surgery applicants as well. But we did have more applicants to positions than previously. And again, you can see how the applicants broke down as to who filled those positions. And thank you.